and into the 20s, arguably beyond that, but those periods in early life and adolescence are terribly important. So we know that there's a lot of things that drive down the life trajectory that people are up against: poverty and adverse social determinants of health, whether it's hunger or housing circumstances, availability of good food, availability of safe neighborhoods. Availability of safe neighborhoods, so important to children and families. We see that we have an overrepresentation of children from our poor neighborhoods in the hospital. They are more likely to be here with more severe conditions, stay longer. And this is scientifically valid because we have evidence across the range of diseases, whether it's low birth weight and need for neonatal intensive care, whether it's asthma and obesity. All of these diseases are more common in the lower income groups. And it's not a cliff, it's a gradation, if you will. So from very, very little money and resources, and the social exclusion that means. We all know that if everybody's living in a certain way, that's not the issue. It's the social exclusion that results from this poverty, the exclusion from the factors that determine health. This exclusion is really the issue. When we look at mental health, and I'm thinking of a wonderful session that was one of our priority neighborhoods, well, it was the Jane Finch neighborhood, or the youth there organized a wonderful session on mental health a couple of years ago. And the great speakers from the major mental health agency and the major mental health agency, though, started with the first two mental health questions. How did you sleep last night? And have you eaten today? Those are the first two mental health questions, no question about it. And when you think about it, so many of our patients can't answer those questions well. Our school teachers and principals tell us the same thing. The children are not answering those questions well. How did you sleep last night? And have you eaten today? And these are very, very fundamental questions to Canadians, very fundamental to our current and future circumstances in Canada, and there's no excuse for those questions not being answered well. It's not just an in-house look either. These sorts of things are determined internationally, and Canada does not look good on the outside. The Economist looks at Canada now and then and had titled one piece in the last year or so as "Canada, Mean Streets," and they pointed out how we have had a relatively mild recession here. We have not suffered like a number of other high-profile countries, and yet we have a child poverty rate and an expenditure profile on families and children, which is down at the bottom of the OECD countries. And our children are not doing well. When you look at rates of alcohol use, when you look at rates of child-parent interactions in these big health behavior of school-age children surveys, Canada is not doing well internationally, and national media, such as The Economist, has called us on that. And